Years of financial hardship and medical neglect caused our next guest to spiral into a place of low self-worth. Her situation left her feeling pain, not only inside, but on the outside as well.
I'm only 42 years old, and I'm on the verge of not being able to chew my food or even be able to walk. I have had so many teeth pulled that I've lost count. The one back tooth that I do have is my only chewing tooth left up there. I'm afraid if that one comes out, I'm not gonna have any way to chew anything. When I look at my feet, I just see horrible things. My nails have now started to twist, curving inwards and digging into the skin. It's painful, very painful. All I feel is throbbing of my heartbeat in the tip of my big toes. This is my life living in constant pain. I feel like I'm falling apart. When I was 13, I got braces and headgear and all of that. My teeth look beautiful.
When I first met Tina, her teeth were perfect.
I've always brushed, I've always flossed. But throughout the years, I started getting cavities. My insurance didn't cover for fillings, so they just pulled teeth. 10 years ago was when I noticed that my nails were getting thicker. They would start growing into my skin, so that kind of like backed me off of trimming them because they were painful, and it has just gotten worse over time. I have tried antifungal creams. I soak my feet before I can try to trim my nails. I've been wearing orthopedic shoes for approximately about 8 years, if not more. Just one style. There's no other shoes out there for me. I can't even imagine how it would be to not live in pain.
My wife, she's an awesome mom.
I not only love my kids, but I love all kids. And that's where I've taken up the volunteering at the schools.
Tina has a huge heart. She volunteers for everything she can do.
I'm a crossing guard at the school. I try not to limp around kids because I don't want them to think that, you know, my leg is hurt.
She loves to make people laugh, and it's so hard for her to do it when she's got her teeth the way they are.
People used to tell me they loved my smile. It's so ugly. I never sat in the mirror and looked at myself. It's just really sad. I have grandkids that need me. I have my kids that need me. My worst fears are not being able to get up and walk one day. And I'm almost there. I'm almost there.
Tina joins us, and I know you have a lot of medical problems. I know you've had so many hardships. Yet it's obvious you have the most important thing of all, which is an amazing heart. I want to thank you for being here to share this with us.
Thank you. So what's been the hardest part?
The hardest part is getting up and enjoying activities with my family, my children, my grandkids. Walking is a constant pain every second of the day.
And Kevin joins us in the audience. Kevin, she seems like such a beautiful person inside and out. What have you noticed about your wife as she's going through all this?
My wife, she's the most caring, giving person I've ever met, and I just hope maybe you guys can help her.
You know, Tina's here not just because of the cosmetic problems she's had. Her issues obviously much deeper than just her skin. Her health conditions have left her with pain. It's difficult for her to walk. We actually sent her to foot and ankle specialist, Dr. Kasrabadi, and celebrity dentist, Dr. Maddahi, for a much-needed diagnosis.
I see that there's a lot of teeth that are missing. Tina's mouth is one of the worst cases I've ever seen.
Number 1 is missing, 2 is missing, 3 is missing, 7 is missing, 12, 13 missing, 14, 15, 16, 17 is missing. Close. You hear a clicking noise. Because you have had so many missing teeth for so long, there's a bit of a joint damage. There's a broken filling here. Yeah.
Worst case scenario is there's just not enough bone to support the existing teeth that she has, and we have to pull more teeth.
I really need a lot of work done. I didn't think it was that bad. I'm afraid of being with no teeth, and I don't want to have to lose more. I've never been to a podiatrist. I'm really embarrassed about anybody seeing my feet.
Tina's feet are in very bad shape. I can only imagine how much pain she's been in the past 10 years. Does it hurt right in this area?
Very painful.
So you're dealing with two separate issues. You have fungus in the toenails, and then you're suffering from the condition called the bunion on both feet. This right foot, if you leave it untreated, it will eventually become like your left foot.
That's scary.
I don't know if you are a smoker or you've been a smoker before.
32 years.
32 years.
And I just stopped in July.
When you are a smoker for that many years, the lack of oxygen makes the toenails curl. So this could have been a perfect storm, partly your DNA and the fungal infection, and also the fact that you were smoking for so many years.
Wow.
I'll just clip a little bit of this toenail. We'll just take a sample.
Ow, ow.
Don't worry. My concern is that Tina has left this bunion untreated for too long, and when the bunion gets really bad, it becomes arthritic. At that point, you can't really fix the bunion.
I don't know if anybody can help me. It might be too bad.
So clearly, Tina's been dealing with a host of issues, and I heard that you actually have a jar. And anytime you have a spare quarter, you've been putting that quarter in the jar
Yes, we have.
to hopefully be able to fix your teeth. How much money do you have now?
I think the last time that we counted was a little over 200, I believe.
$200
Dollars
towards the
and quarters.
procedure.
Yes.
So I know you're here today for some hope, and I want to start with you, Dr. Kasrabadi. What did you find, and what can be done?
What we found is Tina's feet are indeed infected with fungus, and she has a severe bunion on her feet, which requires shaving and pinning of the bone. And based on our consult yesterday, I think you're a perfect candidate for my procedure. And I'll be more than happy to do that procedure for you.
Dr. Maddahi, again, a lot of issues I know in Tina's mouth, but what did you find, and what hope is there?
So what I found is that because she's had so many missing teeth in the back, the whole point of reference of the bite is gone. She's not able to chew on her back teeth. The bite is too far closed, and the one remaining back tooth is broken. And what has to be done is that the whole mouth has to be restored. And I've done many celebrity makeovers, and I cannot think of a more deserving person than Tina with her heart. And I'm sure that I can do the same thing for her. And the best part of it is we're going to get started right after this show.
And
You're going to be strutting and smiling, strutting and smiling.
Gentlemen, can't thank you enough, because the other best part of all of this is they're offering their services to you completely free of charge. So that jar of money you have, use that to do something nice for yourself, because you deserve it.
Thank you. Oh, thank you, doctors.
Thank you. Thank you for being you and being such a good person. Dr. Maddahi, Dr. Kasrabadi, Kevin, thank you all for being here. We'll be right back.